All right, we're going to get going. We're so prepared, we're trying to figure out who should introduce first. How prepared we are. Good afternoon, I'm Cara McNulty. I'm with CVS Health, and I lead mental well-being. Think of mental well-being as anything we do across CVS, whether it's through Aetna, and it's a behavioral health service covered in our health plan, whether it's care delivery within our minute clinics and health hubs, whether it is a payer agnostic service we have called Resources for Living, which is really about meeting people early up front to address your total mental health and well-being. So it's a pleasure to be here, and I get to do this with a friend and a former colleague. We work together at Willis Towers Watson, and I'll turn it over to Michael to introduce himself.
Thanks, Cara. Michael Perlmutter. I lead the Insights and Innovation Lab at Lockton Companies. If you're not familiar, Lockton is the largest privately owned insurance consulting and brokerage firm, and we do have a global presence, but predominantly in the US. In my group, we work with large employers. So a lot of people say to me, that's the coolest title, right? You lead Insights and Innovation. Isn't that what this is all about? But what it actually means is that I'm about a mile wide, but an inch deep on everything, right? So when it comes to the topic of behavioral health, I'm so pleased to have someone like Cara with me to be my safety net, because I'm learning so much through this conference, and I think it's a great mix of who's here in the audience. But we were really asked to think about this from the perspective of employers and understanding the challenges and the opportunities that are present today. So when we, Cara and I, talked about this initially, there are really three issues that we wanted to try to tackle through this discussion. It's really about, number one, access to care, right? The number one thing that employers are concerned about is access for their employees, and how do we facilitate that, driving awareness and helping employees to get access to the resources that they need. Number two, it's about quality. And when we've heard a lot today about quality measurement, there was an excellent panel on that earlier, which I'm really grateful for that group of clinicians who are really focused on that. But really, we have a long way to go when it comes to measuring and improving quality, and really just understanding what we should be measuring. And then really when it comes to the third issue that I think we can try to solve together with health plans and other solution providers in the room, I think it's about integration, right? So there's so much fragmented care. We hear about point solution fatigue. We talk about all of the different solutions are here, but how do we actually bring them together in a way that addresses the needs of employees most specifically? And so that's what we're hoping to dig into today. I also just wanted to frame up some of the challenges that employers see from a cost perspective, because that is one of the key issues that we wanted to address. So when we think about cost as it's associated with behavioral health care in particular, we're actually, as employers, we're thinking we're okay with increasing cost related to these services. And the reason is because the vast majority of our employees also have a comorbid chronic condition. And so if we can drive that integration, if we can actually identify people in need and give them the support, if we increase access, I think that's a good thing, right? So that's one of the areas that we wanted to dig into. The other problem, though, with access is that they are simply either not finding care, or in half the time, people are using a primary care physician. And we can really talk about limitations that primary care physicians feel in terms of their confidence in their ability to prescribe and to help a person navigate their care. So those are just some of the things we want to unpack, and we're going to save time for all of you to ask questions, because I'm sure you're all here and curious and want to hear from Cara. So with that, Cara, can we just start really at the high level of really framing up what it means for employers to build a culture of well-being. I think prevention is so important. It's such an important part of this process. Can you just share with us some of your thinking?
Absolutely. And I think anyone who could say they are deep in every aspect of mental health is a unicorn. I mean, all of us are trying to, every day, how do we do this better? How many of you woke up today and said, today I'm going to focus specifically on my mental well-being? Well, hot dog, right over there. I often start every conversation like that because most of us woke up and life starts happening. And whether that's you need to figure out how to pay a bill or get kids to school or deal with something at home, but it all impacts our mental health. And then we go to work and we bring all of that with us. And as employers, and I've been a plan sponsor and been in this role now for about 5 years, you know, we want people to bring their full self to work. I mean, how often do we say we want people to bring your full self to work? I want who you are at work to be who you are at home. But if we really want that, which we do, it means we have to look at the value proposition between employee and employer differently. How many of you have changed your benefits since the pandemic? How many of your benefits are geared more towards the wants and needs of employees that probably before the pandemic you didn't think you would lean into, like flexibility, elderly care, child care, legal support? I mean, employees want different things. So when we think about a culture of well-being, if we really want people to come to work and be their full self and not be somebody different at home and different at work, if we really want them to show up mentally, physically, emotionally, and, oh, by the way, we want a diverse and inclusive culture, without a foundation of total well-being with, I'm going to say at the center, the importance of mental well-being, we're missing the mark. Because none of us also say, well, I'm going to compartmentalize and today I'm going to focus on my mental health and tomorrow I'll focus on my physical health. So in building that culture, that means as payers and providers and plan sponsors, we have to do it differently. One of the things that I have found to be so amazing because of the pandemic is what employers have done. And it doesn't all come together, and we as providers and payers are trying to help it come together. But how many of you have implemented a new behavioral health, mental health, total solution post-pandemic? Yeah. People want to lean in. So when we think about the culture of well-being and the culture of mental well-being, what we need is to make it easy for employers to provide support and care and services, whether your people are medically covered or not, because health is contiguous. We need to make it so our employees can show up and be exactly who they are in all their glory, and we need to make it so it's easier than it is right now to find care.
So where do we go from there? Those are a lot of the challenges that we hear in talking to employers as well. Like, we have all of these solutions, and yet we're struggling with the number one problem of awareness. The employees don't even know. Like, I think the question about open enrollment is great because we're all going through that process, but is there a button that you check that say, yeah, I want to sign up for my EAP this year? Did you even know that it was just integrated, it was part of your health plan, or it was available, to you already? We need to find more creative ways to put that out front and center during events and experiences to drive that awareness. And I think we'll get into the integration topic about how that can better support people most in need. But maybe if we could talk just a little bit more about, the role of the EAP and how that's evolved and really what you see as the next phase for that from Aetna's perspective.
Well, we believe we are in a huge transformation as a society when it comes to employee assistance programs, because even the term EAP is really out of date. And if you ask people what they think an EAP is, often employees say, oh, that's the place you call right before you're going to get fired because you don't get along with your manager. I mean, that's really a reality. When we look at where EAP is evolving, it is really that how do we help people remove the barriers that are tripping them up or getting in the way from them being their best? It might start as a social determinant issue. It might be a work-life or legal issue. It might be anxiety or depression that has gone uncared for. It might be because you're taking care of an aging parent, if you were in the session before, an aging parent, and you're exhausted. You're exhausted, and you're trying to care for someone, and your mental health has gone to the wayside. So really the EAP reform is underway. And employers are doing an unbelievable job defining what EAP is and what it will be in the future. An EAP today often has low utilization. But when we change what it is, when we give employees what they need, social determinants, work-life support, coaching, access, diversity and inclusion, when that encompasses your EAP, what we see is really high utilization. So it's really reforming, renorming what an employee assistance program is and how we can do that. And I think we're just scratching the surface. We're just scratching the surface because, I mean, until we get past the point that access is the total goal, I mean, access is like, do you want to feed your kids today? Yes. Access is, do people need to be cared for? Yes. Now we need to make sure they have the right care at the right time with the right provider in the right setting who looks like me, who understands me, and we don't have a bad experience. And I'm by no means going to say that we at CVS Health, Aetna, have that figured out. We are working on it. But when we do that, when we lean into that employee assistance and redefine and reset the norms, that's when we're going to see engagement.
Yeah, that's really helpful. And I just wanted to add to that an example that I had in my business recently where, again, I live on the employee benefits side of the house, but the other aspect of Lockton is we have all of our property casualty insurance. And so I had a team from our construction management practice contact us and say that they're struggling with some of their construction, general contractors who have subcontractors on site, and they have higher levels of suicide. They have other incidents in the workplace. And they said, what can we do to help address this problem? And they're at a loss. Like they're on a different planet than we are when they think about it from an insurance risk standpoint, right? Risk mitigation is so important. And so we really started talking to them about programs like mental health first aid, something that they weren't even aware that existed. But that's just an example of where, I think manager training is so critical to providing that level of support. And then beyond manager training, if we think about just day-to-day employee training, like what is it that people really want? As you said, like how do they bring their whole self to work? I think that's where we really have to change the way we think about learning and development, because it's in that space where we're teaching resilience, where we're really talking about equipping people to handle difficult conversations at work. We're teaching them how to manage stress and how to be more effective in their role. And that's sometimes what people really want, is how do I actually excel and in my own life, in my professional career and in my personal career. So I think those kind of understanding those individual personal objectives, I think, can then tie to the awareness factor and really help us expand the notion of where people go to get care, right? It's not just one place, so.
Yeah, I do think, though, until we talk a lot about normalizing the conversation, but until we really change the ecosystem that an employee can say, I'm bipolar, and not feel that there'll be retribution, we haven't pushed hard enough. Or that you can say that I have a substance use disorder and I need help, but that doesn't mean that I want you to give me less work, or I want to be, put on a limited assignment. And that's really different. If anyone in this room is in HR, you're probably going, oh my gosh, yikes. Those are the conversations that, I don't know that we have to have, but those are the conversations we have to have. We have to have, and we have to set it up that our employees feel that they can come to work to address those. So I'll ask Michael a question. So what is it that employers want, and how do we know that?
Yeah, and how do they know when they're getting it, right?
Yeah.
That's the real question. So we've touched on a couple things already. I'd start with prevention, right? Really, actually start with awareness. We need to drive, address stigma through communication to improve awareness, focus on prevention, but also begin to focus on improving access, right? So when we think about access to care, we know that there's shortages of providers, and there's been a lot of discussion about why that is. But from an employer standpoint, the solutions that we're implementing are things that are intended to promote broader access to care where maybe there are disadvantaged populations. So if we think about whether it's virtual care or digital health, those may either supplement other resources or act as a part of the process where someone is using digital therapeutics in addition to meeting with a coach or a therapist. And those are all care extenders and ways for employers to think differently. So we've been introducing a lot of new programs, virtual and digital programs, to help improve the access. I think when we talk about cost, I mentioned this up front, but I think it's really important that we are thinking about cost differently, because we do want to drive up utilization, and in some cases, leading employers are willing to drive up reimbursement to get what they need. The question there is, do we actually need to incentivize providers for quality, right? Why do we pay them the same, and why are we paying them so much less than a surgical provider, right? And so there are certainly issues of reimbursement that I think we need to tackle. But then, what employers are really, I think, in the years ahead, focused on quality and understanding what it is that we actually need to measure, right? Are we able to capture metrics that are not just, process improvement or utilization metrics, but are we really understanding the delivery and the quality of care? And getting back to my original question, are we actually understanding what the employee or the end consumer is trying to solve? And are they getting that outcome? Because they could be getting that outcome from 1 visit or 10 visits. And that should be, we should be indifferent to that, but we should make sure that they're getting the outcome that they're looking for. So, certainly when we're concerned about quality, one of those questions I did want to come back to you about is, how should we be thinking about that from, what are some of the barriers to measuring quality and actually, collecting data?
So this group could answer it better than I can. It also comes back to the fact that we have to align on common measures. And those measures have to be more than, did someone get an appointment and how long did it take? It has to be, did they get an appointment? Was it the right match? Are they connecting? What's happening as a result of? And how do we know that the individual is making progress? Now, that's a lot. And that takes all of us to work in partnership. So from a health plan side, that means how can we make it easier for providers to share their data? And how can we help them share data? And how can we align on what the data fields and deliverables are that we need? And what does success look like? Because if it's just, did somebody get care? And again, listen, we need people to get care, but we got to raise the bar. We need them to get quality care, and we need to know, is it working? But that's all of us. I mean, that's on the plan side. How do we make it easier for people to share data? On the provider side, how do we help providers feel confident in sharing data? How do we pay more when outcomes are achieved? And then I would say one of the areas that I can't wait to see some innovation in is behavioral health value-based contracting. Because I'll tell you, we don't know how to do it well. We make it hard for the innovators, and I say we as a collective, it's hard for the innovators. What does success really look like? And then making sure we have the systems to capture that what we agreed to deliver is being delivered. Because otherwise we're buying, we're getting people to care, but if we can't really show that it's helping and improving or mitigating, then how do we know it's working?
Yeah, and just to expand a little bit more, I also wanted to talk about that issue of integration, because when we're thinking about the population here who's most at risk, we're talking about individuals with a behavioral health condition who 80% of them have a comorbid condition, and then from there, half of them are actually in active treatment. So of those that are in treatment, we're seeing 20 to 40% higher costs for those individuals. So integration is, to me, something that employers are challenged with. We're looking for partners to also help us solve, but it's, I have an individual with diabetes, and they are dealing with day-to-day issues associated with that, and they may have comorbid depression, anxiety, and other issues. So how do we, stop bisecting and, saying you are your condition, and instead have a more holistic approach to treatment where, we're making, whether it's referrals into behavioral health or, leveraging primary care better to refer into behavioral health providers. There are so many different aspects of integration, but it feels to me like we're just in the early innings of, we've got all this stuff, our employees only know about half of it, and then of those that know about it, they don't work together very well. So how do we solve that, Cara? Do you got any ideas?
I mean, I think that's what we're all trying to do, but it can't be a one-size-fits-all. So how do we make it easy for people to seek care before they're in crisis, and even when they're in crisis, but long before? How do we, as systems, employers, payers, providers, pull the system together so the employee doesn't have to do the heavy lifting? Because right now, that's who does the heavy lifting. We do the heavy lifting. How do we pull that all together? And we ensure that what people are getting is in a timely manner. It addresses their needs. We're checking to ensure that we're getting the quality outcomes, and we're addressing them as a whole being, their physical health, their mental health, which includes their social determinants, which includes all the things that happen to us as we wake up. But that requires all of us. And so when people say, you know, there's point solution fatigue, that's for everyone. Everyone. I mean, how do we all pull the ecosystem together so that the individual doesn't have to be the one trying to figure out, okay, well, I have to go to this app, or this is covered or that isn't covered, because when you need care, nobody cares where the coverage is. You just want help.
Yeah, I just wanted to expand on that too. When we were talking about EAP and really the evolution of the EAP model, I think one of the benefits of these newer models is navigation, right? So we're seeing newer models that are focused on triage and identification up front, you know, doing some type of screening so we can get a baseline understanding of what level of care is most appropriate. One, to solve the access issue, but two, you know, to get people to a provider that is going to actually be a good fit. Because, you know, part of the access issue is I can get an appointment, but I can't get an appointment with somebody like me, right? And I think that, you know, it's the shortage that we're dealing with, diversity, equity, and inclusion issues alike. We are really, you know, there are huge gaps in getting people access to care. So I think the notion that employers are really focused on that front-end navigation piece to help employees with the awareness to drive to various digital and virtual type of solutions, as well as to connect that back beyond just the EAP to integrate back into a broader behavioral health network. So, you know, employers are really thinking about the full continuum and how we can design a single platform that does all of those things rather than having, you know, 5 different solutions for the various range of products that I just described.
Yeah, and that's pivotal, because if we don't manage what the ecosystem is to look like, then people fall through the cracks. I mean, people might start with their EAP, but if we don't get them connected because they need a higher level of care, and let's say they don't have insurance through their employer, then through the community, we're going to have a problem. If we lose people because we wait until they're in crisis and we didn't get up front, we have a problem. So really looking at what's that navigation to ensure that we're getting people to the right level of care, and how do we continue to advance taking the burden off the individual. People should not have to know what they don't know. I say this all the time. I had postpartum anxiety after my second baby, and I was in this field and could have told you I thought I was having a heart attack. I mean, I was sure. I'm like to my husband, I'm having a heart attack, and he's like, I don't think that's a heart attack. You know, we have to make it easier for people to get care. You know, before we go to questions, I would love, from your perspective, where do you think we're going with technology, and where do you think we're going to see advancements, and what are watch-outs?
Yeah, I'm super excited just being here in this room and at this conference because of so many things I've learned. But I think that there is an opportunity to really improve measurement. And when I think about measurement, really at a basic level of whether or not the intervention is actually improving my quality of life, right? So simple integrations like with Apple Health Kit to understand, is my movement activity increased, you know, over the last 30 days as a result of, you know, whatever intervention I might be taking advantage of? Is my sleep improving? Is my nutrition improving? Like these are the real measures that people actually care about, and I think where technology can go is, and where permissions are needed, is to, certainly have patients, participants opt in to those types of solutions. But to the extent that people are willing, and I think that they are, we're so willing to share out loud, like everything that's going on in our life, why not share that with your providers, right? I think that's a huge opportunity for technology to enhance the course of treatment and to really tap into what the individual's needs are and what their desires are. So that's number one from a technology standpoint. I think just, where we are today with digital, and I think digital solutions should be viewed as either support to or enhancement of a clinician or therapist care, but they can be done, in isolation as well. I don't think that there's any one solution for any person, but it's important that we continue to build the evidence around that so that, people feel confident. But sometimes we subject digital health solutions to even more rigor than we do to the clinical intervention, right? We don't submit the therapist today to the same level of rigor and randomized controlled trial that we're trying to submit digital health through. So that's where we need to go. We need to get better at trusting the process and actually proving it out over time. But that's where I think, advancements in technology will take us. And then ultimately, from an integration standpoint, I just think, the existence of AI, whether it's to provide either, insights to the therapist or insights to the individual from a coaching component, there's so much that data that could be harnessed just from your phone, as I was mentioning before, that could give people the nudges that they need to really, help solve whatever issue it is, life crisis or otherwise. So I'm really, optimistic about where technology's going, but looking forward to hearing what questions you all have about anything that's going on in the employer space.
I'd also like to know if, not only your questions, but if there are things you're doing that you think are really important for other people to hear. That's how we learn in this space. So welcome your questions. I would say one thing that I'm really excited about is the evolution around how we define mental well-being, how we meet people where they're at on this journey, because it isn't linear, and how we transform the EAP, the Employee Assistance Program, to be something really robust in a way that removes the barriers, removes the stigma, and doesn't require people to be experts in every part of mental health. They can just say, I'm not feeling great. And I'm hopeful for the day that we can have, our employees can call in and say, I need a day just to take care of my well-being. Just to take care of my well-being and even my mental well-being.
Yeah, if you have questions, there's a microphone right here, if you wouldn't mind.
Thank you so much for this. I kind of see in behavioral health, a supply problem and a demand problem, right? So supply problem, obviously, with getting enough, high quality care and care providers available. But I'm really curious about the demand side, especially in this particular field where individuals have to be highly motivated. So I'm very interested in some of the comments that you've been making about catching people early on, but then also the other flip side of retention. So I'm very curious about what innovations or what interesting ideas you've seen that are those nudges, right, that are really supporting people to encourage them to take the next right step, right, on a daily basis. What are the small things that people can do, and how can, employers, how can the healthcare system provide those nudges? And just interested in what you've been seeing that's exciting in this space. So thank you so much.
Oh, I think there's so much. How many people do something every day for their physical health? You try to exercise, you work on your sleep, you're conscious about what you eat. We don't have those discussions about mental health. And those discussions have to happen everywhere. We make assumptions about mental health, and so the more we talk about the importance of taking care of our mental health and our mental well-being, that's one action. The other thing is we have to make it okay to talk about it in a way that doesn't mean someone's broken. I mean, I shared I had postpartum anxiety and, it wasn't a good situation. I bet nobody in here is saying, oh, she's broken, shoot. No. So we have to change the nomenclature, and then we have to get to what are the policies, the systems, and the environmental changes that need to be put into place that make it easier for people to have access to care. So policies, what does it look like to provide, let's say, a new employee assistance program that delivers high quality care virtually, telephonically, async, and in person in a way that we can measure that people are getting better? How do we support people who need care because they are caregivers and they have a parent who's dying? I mean, really just evolving how we talk and how we deliver, but it has to be part of the normal conversation. It can't be the afterthought. I dream of a time when the first thing when someone is pregnant, the first thing we're talking to them about is their mental health and that of their baby, even before they're getting pregnant. Like, if we don't put mental health at the center, it's going to be an afterthought.
Thank you for the opportunity to ask questions. My name is Jamie Belcito. I'm the founder and director of policy for the Maternal Mental Health Leadership Alliance.
Hot dog. Look at
So I see you. And I would dare say if you were any better than you are right now on that stage, going through what you went through to get to where you are today, then hats off. So thank you for sharing your truth. Absolutely. And if you want to trade anxiety stories with me later, I'll be available outside.
Hot dog.
Okay. I had two questions, one for you, Cara, and one for you, Michael, and I thank you for the conversation. You spoke about policy. That's kind of my love language with the change of what needs to happen. Where do you see, and then I'm going to ask Michael a question, if you don't, where do you see the opportunity for private-public partnership in this space, right? We are continually seeing our congressional funds being, in public health in particular, being defunded. And, well, at least the lights will stay on with the government, but they really just level funded or cut everything. Then my other question, so I'd love to hear, CVS is doing a great job, and I am a Bostonian and have always gotten my prescriptions from CVS.
We wouldn't have guessed that you were a Bostonian.
Oh, no. If one more person asks me what part of New York I'm from, though, I'm going to be very upset.
I knew Boston.
Thank you, Cara. I appreciate that. And then, Michael, my question in the space of the coaching and with AI and these fabulous handheld phones is, at what point or where is the intersection to where coaching doesn't work anymore and somebody actually needs to be admitted or to find specialized help? So I thank you both for this opportunity. This is something I'm interested in and look forward to your response. Thank you.
You go first.
Okay, I'll take the second question first then. Thank you. Yeah, I think it's really interesting that I think we have to move beyond the phone. Like when I talk to my daughter and my wife about it, they say, it's my phone that's stressing me out. So the first question is really like, can technology take us beyond the phone? And I didn't mention that in my initial comments. But I think beyond that, the opportunity is really to get back to the issue of, what am I trying to solve? And it's so connected to whether it's sleep or caregiving needs, what is the root cause issue that I think that will determine that the level of technology or need that is ultimately involved. I'll give you an example. I have a daughter with Down syndrome, and just knowing that she's cared for and my wife is her caregiver, and being able to keep track and monitor her is, giving me confidence to be able to go on a trip, right? Like I need to know that, but I also need to be able to check in every once in a while and just see, how's she doing and what's happening at home. And so I look at technology that way and just think about so many other aspects of really understanding what it is we're trying to solve. I don't know if that got to your question, but yeah.
I think without public-private partnerships, we won't ever solve these issues. I have been a federal employee, I've been a state employee, I've worked in a community setting, I've worked for the public sector, and no one can do it alone. I mean, now, believe me, when I started in the federal government, I thought, oh, well, we have this all together, we can do this, and you can't. And so I would say it's not, we have to have the partnerships, but I would say it's how do we bring people to the table and not say, gosh, government, they should do it better. Because it's easy for me to say the government should do it better. But then I was at the government and I remember thinking, they just don't get it. I mean, I'm accountable for taxpayers' dollars and I have to balance my budget down to $100. I mean, so how do we convene sectors together and get, not try to do it all? What are we trying to solve and how do we do it with government doing what they do best, with policy forums doing what they do best, with payers doing what they do best, with providers, instead of thinking we have it all wrapped up. But I don't think we can make progress without the partnerships.
I think we have time for one more.
I'll try to be quick. Thank you both so much. This has been a really great discussion. My name is Amanda Conway. I'm the Chief Growth Officer of a company called Apti Health. We are focused on high acuity patient populations and really focusing on value-based contracts and how we can integrate within a regional location before expanding more broadly. And so it kind of caught my attention as you're talking about innovation in this space, that we don't have it all figured out yet with value-based contracting, but I'm hopeful we'll continue to make progress because that's ultimately what aligns all of our incentives towards the patient and the outcomes. So I'd be curious just to hear you talk a little bit more about what you might be seeing work well. What are some of the challenges that you are experiencing when it comes to value-based contracting? Because I also get very excited about where that's going and where we can go with it. So thank you.
As a system, we're set up to do basic contracting with the provider, and that is you deliver a service, we pay you for that service. The ecosystem isn't set up to say, what if we looked at hitting certain goals, and what would those goals be? How would we monitor that via systems and technology? What if we did a bundled payment? What if we did a care collaboration and coordination and put risk on the table? The ideas are vast, the systems aren't there. And so we have to start small on what would it look like to really advance a value-based contract in behavioral health that isn't at risk for the provider so that they're carrying the load, that isn't a huge lift in changing all of the technology and data infrastructure, but most important, so that the member has the best outcomes. And there's a lot of conversations about this going on, but I don't believe that we as an ecosystem have come to how to make that work. Because at least I'll speak for Aetna's payer system, our contracts are we're set up to do general contracting, not, and we're pushing, but we need innovation there. We need to look at What does success look like? How is this not at risk for the provider or the payer or the employer in a detriment situation? But most important, how do you keep that member at the center? And so I hope we continue to have, there's conversations going on all across the country, but we need them more collectively. And so I'm not giving you a great answer because I know people want, well, it's this, this, and this. We're not there as an ecosystem.
Yeah, I think we are out of time.
Yeah.
So thank you all for coming.
Thank you.